Hi, my name is Max Cantor. I'm the Vice President of Connections Physical Therapy. I know it's all a strange time that we're in, so I thought I'd be able to give you some information and provide some education on a very pertinent topic for right now, but also in general, balance. So many of us struggle with balance and struggle with balance type of activities, and we often hear about it, but we don't necessarily hear about what we can do about it, how do we improve it, how does physical therapy play a role in balance. And so today what we're going to be doing is talking about the basics of balance, how we do it and how we assess it in physical therapy, and then how you can also progress and challenge your balance so long term you're able to improve it. So like I said, today we're going to be looking at the basics of balance. We're going to learn why our balance worsens over a period of time. We're also going to talk briefly about 4 different assessments that we as physical therapists use to improve to test and evaluate balance. And then we're also going to talk about some different exercises and interventions that we use in physical therapy to help with your balance long term. So one thing that's often misunderstood or not talked enough about, in my opinion, is that there are many different variables that play a role in keeping our balance. So there are so many different things that work together instantaneously for us to maintain our balance during regular standing, walking, change in direction type exercises and activities. It's amazing how quickly these work together, and it's all subconscious. We don't think about it, we don't actively perform it. It's something that subconsciously and instantaneously happens within our body. When one component of balance is reduced, another part of that balance picks up the slack. So all these different components come together, but it's also important to realize that when one component isn't working as well as it needs to, other parts of our balance can pick up that slack to allow us to maintain, improve, and progress our balance. So what are those different components that we're talking about? The first one is vision. And so we often look down at the ground to see where we're going, scan the environment to make sure we know what's around us, because balance is really a big component, and vision is a big component of our balance. The other is sensation. So oftentimes people with diabetes or loss of sensation in their feet can have difficulty with balance because of how important it is to our sensory system to play a role into our balance training. Strength. The stronger our muscles are, the sturdier our legs are, and the sturdier we feel. And so as all of our muscles are working together to maintain our balance, keep us upright, change direction, step up, step down, catch our balance if we slip. So those 3 are more common for us to understand and to know about. One component that isn't talked a lot about or isn't well understood is our vestibular system. That's kind of our inner ear. There are many different components of our vestibular system, but we also know that the vestibular system plays a big role into keeping us upright, having a good sense of where our body is within space. Also endurance. People tend to fall towards the end of a day versus the beginning of a day, or after a long walk, or when they're tired. So again, it plays a role into strength and other components, but when we're tired, we're at a much higher risk of losing our balance. So this is a great slide that I love to talk about. It's a great study. It's looking at our balance over time for normal values. So these are people who are healthy, active, doing everything that they need to. And what we see is that over time, this is how well we can stand on one foot. This is our age down below here. And so when we're 18 to 39, we can stand on one foot for a while. The top line is eyes open, the bottom line is eyes closed. And so you can see a pretty significant trend heading in the downward direction as we age. And remember, this is normal value. So this isn't people who have a lot of other comorbidities or have other reasons for poor balance. These are normal, healthy people. And so even when we do everything right, when we get to this late 50s, early 60s, especially into 70s and 80s, we see a stark and steep drop-off of our balance. This is with eyes open. Again, this is with eyes closed. And so a lot of people come to me or talk to me about their difficulty with balance, and they're not sure what they did wrong or why they've lost their ability to balance during certain activities. Well, here we go. No matter what we do, we tend to have loss of balance ability as we age for the normal person. And so it's something to keep in mind. It's something that's really important to discuss in physical therapy and just in general. And so how can we explain that? Why do we see that the stark drop off at that age? Well, let's go back to the different components of balance. Vision. Over time, our vision is worse. We don't see as well, we don't see as clearly. Sensation. We're not as responsive. Our sensory system, the sensation of our skin, the sensory components of balance are not as responsive over a period of time. Strength. Our muscles just aren't as strong as we age. And so our muscle mass and our muscle strength worsen over that period of time. Our vestibular system, we'll talk a little bit more about that later on, but our vestibular system is not as responsive. We don't have that immediate reaction like we do when we're younger. And then endurance, unfortunately not as good over a period of time. There are other components why as we age our balance isn't as good. Spinal issues, neuropathy, which is a loss of sensation, maybe improper use of assistive device. But as we age, we're at a higher risk and a higher likelihood of having other comorbidities that are going to play a role into balance. So as we're dealing with this kind of crazy coronavirus outbreak, I thought we'd bring some rosy ideas and rosy thoughts to you. That's kind of the sad part and the bad part about it, but we'll be getting into some more positive thinking. Sorry to bum you out on a day like today. There is hope, I promise. There's another side of this presentation. Just because balance becomes more difficult over time doesn't mean we can't improve it. And so yes, we do see that downward trajectory as we age, but it's also important to know that we can maximize for as good as we can. You can be at the top portion of what you're able to do or at the bottom portion of it. So just because, yes, you are not going to have the balance of a 20-year-old doesn't mean you shouldn't have the balance to be able to walk, change direction, walk and turn your head, walk and talk with somebody. And so we're not sitting here saying, well, you turn 55, you turn 60, your balance is over. No, it just means that we have to do other components and other activities to maintain how good our balance can be. So a little disclaimer here, I often give this presentation in person to people and I talk about it, but because this is more of a virtual presentation, it's important to get evaluated before starting any balance intervention. There are medical reasons why you might notice a significant, rapid decline in your balance, and that needs to be evaluated in a time-sensitive manner. So it's important to know that if you're seeing a significant sudden change in your balance, that we need to rule out any more red flags or any other serious medical conditions. Today we're really discussing what it means to have a typical slow and progressive decline in your balance, which so many people deal with, but it's also important to know that there are other buckets and other components of why your balance might not be as good. Before we get in ways to improve, I also like to talk about how we as physical therapists evaluate and assess balance. You know, you might be sitting there thinking, okay, I think I might have good balance, or I might not have as good a balance. How is Max or somebody else going to evaluate if my balance is really as good as it should be? So the first two tests that I like to go through are the tug. That's basically a get up and go. You're sitting in a chair, you stand up, you walk 10 feet around the cone and sit back down. It's usually easier for me to demonstrate that, but we have a tight window here with our visual aid, so we're just going to talk it through. There's also the sit to stand test, where someone's sitting in a standard chair, just like he is here. You're standing up and down 5 times. As you can imagine, the get up and go tug test, you have to get out of a chair, walk quickly, change direction, walking around a cone, turn around, and sit back down. Going back to our vision, sensation, strength, endurance, that test alone, which takes 10, 15, 20 seconds, is going to evaluate all those different components in that period of time. The sit to stand test, I view it more as strength and endurance. So oftentimes I'll see someone who can get out of the chair once or twice, by the third, fourth, or fifth time, they're not able to get up because their muscle strength isn't there and their muscle endurance isn't there. And so we do these tests. What do we look for? Any time over 13 seconds to get up out of the chair, walk around the cone, and come sit back down puts you in a higher risk category. The way we look at that is we take 100, we take 1,000 people, and we do the test. People who are over 13 and a half seconds for that test are of a higher likelihood down the road or in the short to long term have a risk in the near future. If someone's already using a cane, a walker, or you have to use your hands to get out of the chair, that alone puts you at a higher risk for a fall. So again, I don't want you trying this at home. If you're doing any of these tests, you need to be supervised and managed by a medical provider, a physical therapist, but I like to just explain what we're looking for and how we're looking at it when we do an evaluation for balance. The 5 times sit to stand, same thing, we look for time. How quickly you're able to do that. Do you need to use your hands to push off? All of those things play a role into how we are objectively evaluating your balance, but then also more subjective, the quality of movement, the strength, some of the compensation patterns that we see. So 2 more tests that we'll often do are single leg stance. If you remember back to the study, we looked at the normal values of how long someone can stand on one leg. That's a good objective way to show your balance. And then a 10-meter walk test, how quickly you're able to do that. Single leg stance, all the vision, sensation, vestibular, endurance, muscle strength, all those things play a role into that. The 10-meter walk test, we're looking at more walking speed. And so again, someone who walks slower versus faster is going to be at a higher risk for a future fall, or put you at a higher risk for a fall. Same sort of thing, we're looking at how long we're able to do that. These are normal values, but it's also it's important to remember that if you are 50 years old, we have different standards for you than if you are 80 to 99 years old. So if you're 80 to 90, you're only expected in normal value to be able to do it for 6 seconds. If you're 50, you should be able to do it for 37 seconds. These are normal values, there's a range, but it's important to know that if you are 60, 70, 80, 90 years old, your expectation shouldn't be that you're able to do it as well as a 20-year-old, but your expectation is that you should be able to hit this benchmark to put you at a reduced risk of falling down the road. Again, don't do this at home by yourself. This needs to be supervised. I just want to give you a sense of what we look for and why we're looking at that. So that was a lot of information. We talked about why our balance gets worse over time, the normal values of balance for single leg stance, and then we also looked at how we evaluate balance training in physical therapy. Let's review that. Vision, sensation, strength, vestibular system, endurance, and maybe some other reasons why our balance worsens over a period of time. As physical therapists, we don't really we can't make an effect or change into vision and sensation. Those are more set structures that either need to be managed by your PCP or some other specialist. What we really look for is that strength, vestibular, endurance, and maybe some of those other musculoskeletal orthopedic reasons why your balance isn't as good as it can be. And that's where we come in as physical therapists. It's important also to remember that there are different types of balance. So when we are sitting, that is balance. We have to keep ourselves upright. And then that progresses from sitting all the way down to walking with head movement. These get progressively worse or harder over a period of time. And so sitting, most people can do that pretty well if you don't have any other serious comorbidity. Walking with head movements becomes much more challenging for a person. And so this, again, as we evaluate and assess balance, we're looking at sitting, we're looking at standing, we're looking at walking, and then when we get down to these higher level activities, although it seems pretty basic, there are a lot of different components that go into why this is challenging for people. And so if you remember, as I said at the beginning, there are many different components of balance, and if one portion of your balance isn't as good as it can be or needs to be, other portions of your balance, other components of balance can pick up the slack. And so when we're looking at if your strength isn't as good or your vestibular system isn't as good or balance specific type of activities aren't as good, we're going to break this down and work on the different components of that. There are many different ways to work on balance. If you go to 10 different physical therapists, you're probably going to get 10 different programs, but the goals are always the same of improving balance, working on specific components of balance. And we're going to introduce some of those topics today about what you might see more of an umbrella idea versus the specifics, because you might get different components of it with different therapists. So the first is strength, and it's kind of the most obvious, I think, or the most straightforward. The stronger your legs are, the sturdier you're going to feel, and certainly as we age, our muscle strength and muscle mass worsens over that period of time. So we're going to give you specific type of exercises to work on different components of muscle groups that help you balance. So here's again some examples of exercises that I would give for someone to work on muscle strength when it comes to balance training. The straight leg raise, the leg goes up and down. You're working on the quad muscle. That's important for going up and down stairs, getting in and out of a chair. The clamshell, one of my favorite exercises, you're working on your glute muscle. Those are your big power movers for when you're walking, standing, transitioning from sitting to standing. Same idea, working on the glutes. I call this one the Jane Fonda, leg up and down. This is a progression of that, so if you can conceptualize it, you're lying down and now you're standing up. Whenever I'm working with someone with balance issues or balance deficits, I like to transition to standing exercises as quickly as possible. So it's important to have some of these more foundational exercises to build up that muscle, but I'm quickly trying to get to standing exercises because they translate to functional activities much better. Most people want to be able to stand, move, walk, talk, and so we want to strengthen and work on those muscle groups in that type of position, that standing, moving activities. Toe raises, one of the easier exercises to do. You're holding on, so you're taking away the balance component. You're going up on your toes. This is working on your calf muscles, especially for the older population that I work with. Calf strength and calf weakness is a big part of why we can't walk as fast, why we can't go up and down stairs as well, and why our balance isn't as good. Our ankles are a big component of how we balance, and our calf muscles are our strongest muscles in that group. Again, strengthening, functional, getting in and out of a chair. The higher the chair, the easier it's going to be. The lower the chair, the harder it's going to be. And so that's why you're going to be able to get out of a bar stool a lot better than maybe that really squishy couch that you have in your living room that you dread sitting on because you know it's going to take you 10 minutes to try to get off of it. And so I like to translate my exercises into functional tasks like sitting to standing. The vestibular system, like we talked about, the vestibular system is our inner ear, and our vestibular system is what allows us to coordinate head, eye, and neck movement. So when I tilt my head one way or turn my head the other way, and my eyes can stay focused on you or an object, it's my vestibular system that's coordinating that movement. I don't have to actively tell my eyes to move. I can just fixate on an object and turn my head side to side. There are vestibular issues like a vertigo, and inner ear issues that are going to cause really significant balance issues. Again, that's not what we're talking about today, but it's important to know that when our vestibular system isn't functioning at high of a level as it can, it's going to play a role into your balance. The biggest component that I see for balance deficits with the vestibular system is our ability to walk and look and talk. And so when you are window shopping or walking down the road and you are looking at different shops, turning your head side to side, when I'm trying to move at the same time, our vestibular system has to coordinate that. When we don't have as strong or as an efficient vestibular system, when we turn our head, we're going to lose our balance, or we're going to feel more wobbly because our vestibular system isn't able to keep up with that activity. It's important also to remember that with these type of exercises that I'm about to show you, you're going to be moving and turning your head, and you really need to be doing this with a medical provider, a medical professional close by, because you are at a higher risk of falling when you're training and stressing your vestibular system. So again, not something I want you to be working on at home, something that I'm just giving you an idea of what we would be doing in physical therapy. So these exercises and activities are one of the stranger ones and harder to conceptualize. If you can see right here, there's a sticky note with an A on it, and the person is fixating their eyes on the A and turning their head side to side, like I talked about before. The next one, they're going to be going up and down, again, fixating your eye on that object. Now we have two different sticky notes, and your head is going to stay fixated, but your eyes are going to go side to side, side to side. Not a very challenging looking exercise, but it's very hard in the vestibular system. And if you can somewhat conceptualize, when you're walking and moving in a grocery store or in a mall, two places that we aren't really going right now, unfortunately, or even walking down the street and you're looking at different houses, different objects, you have to be turning your head and your eyes constantly. Something that we don't really think about because it comes so naturally and subconsciously to us, but when you have deficits in the vestibular system, this can really throw off and challenge your balance system. And so this one is more of the down the road progressive type exercise where you are walking, turning your head side to side, looking up and down, side to side, up and down. Very functional, but also very challenging to the vestibular system. And so we talked about strength training so far. We've talked about vestibular training. Now we're going to talk about balance specifics. So this is probably the most obvious for people and the easiest to conceptualize, that when we're working on balance, or if you've been to physical therapy for balance, you've probably done things like this. The best way to improve your balance is to challenge and work on your balance. Our body responds best to activities that resemble the type of task that we want to do, which is why I do sit to stand exercises, which is why I do walking exercises, because that's what people want to do. If you're lying in your bed strengthening your muscles, that's fantastic, but it then eventually needs to translate to functional activities that resemble what we want to be doing on a day-to-day basis. All of these different things that we've talked about are our specialty. You're going to see your PCP, you might even see a specialist like a neurologist, an orthopedist for balance issues, but really when it comes to the nuts and bolts of how to improve it, if you're not talking about medicine or another type of medical intervention, you're dealing with physical therapists who are going to be progressing your strength, vestibular, and balance. So these are different examples of balance that I would work on with someone who's coming in for balance deficits. Marching on a chair while they're holding on. Trying to stand on one foot. Again, we've talked about that a couple times now. Tandem stance, that's where your heel is next to your toe and you're trying to balance. What we're doing there is reducing your base of support, right? So when I stand really wide apart, it's much harder to push me over. I feel sturdier. If I'm standing with my feet close together, I'm much wobblier. It's going to be easier to push me over because our base of support narrows. All these things we're doing are stressing and working on our balance system. Standing on a squishy surface. So most people have more difficulty with walking on grass, walking on sand, walking on gravel versus walking on pavement. The squishier the surface, the less feedback we get, and the harder our balance system has to work. So we basically stress that by standing on squishy surfaces, balance pads in our clinic, standing on one foot on the balance pad. How about we combine the two, right? So now we're standing with a narrow base of support on a balance pad, and we're turning our head side to side. So that's working on strength, it's working on our vestibular system high up, it's working on sensation because we're standing on that squishy surface. So all those things combine into one simple looking exercise and activity. Same idea, more of a tandem stance, heel toe, where you can even walk the plank a little bit on an uneven surface. That's going to be more wobbly. The more you stress your system within an appropriate manner, the better you're going to translate to strengthening and improving your balance system. So this is normally when I'd ask for questions, but none of you guys can ask me questions because you're watching a recording. I apologize. We'll have some contact information down the road, and I'll provide it to I'll be able to send out some contact information if you do have any questions. But to kind of wrap up today, our big takeaways, it's important to know that if you do everything right, our balance becomes more difficult over time. No matter what you do, your balance when you are 70 years old is not going to be as good as when you're 20 years old. What I wanted to demonstrate today, there are different aspects of that balance that you can work on. to maximize how good you can be with your balance regardless of age. No matter your balance ability, you can improve. So if you're walking with a walker or a rollator or a cane, or if you have no assistive device but you feel like you're not able to walk on the beach really well, no matter where you are on that spectrum, you can improve. And so there shouldn't be a time where you just accept, this is where I am, I'm getting old, can't do any more, I had a good run. We don't accept that as physical therapists. I certainly don't accept that. No matter where you are along that balance spectrum, you can improve and you can get better. So specifically for right now, you're stuck at home, can't go anywhere, you want to be utilizing this time in an efficient way, but you're not sure how to do it and you can't come into physical therapy. So we have telehealth services available through Connections Physical Therapy. Telehealth service means that we're either on a phone call or a video conference, video chat using a HIPAA compliant platform. So if you want to get specific guidance for you and have an evaluation, virtual evaluation with physical therapists, we can provide that. Right now, people are reducing their activity, reducing their exercises, not participating in the group exercises that they normally do. And unfortunately, because of that, we're going to see a lot of regression in strength, balance, endurance, stability. And so it's important that even when we are hunkering down and staying safe at home, that we are doing other things to adjunct the type of activities that we normally would be doing. We can't give you just basic exercises because we need to do an evaluation, so it's important that you work specifically one-on-one with a physical therapist. Even if it's not in person, you can get the guidance and education and assessment from the physical therapist. There's some contact information here. What we've been trying to do and what we will do is connect you with someone who's local to your area so that if and when the world opens up again, you can transition to an in-person clinic close by. It's important also to remember that everybody can improve their balance. So this is LeBron James, one of the best basketball players of all time before a game. He's working on standing on an uneven surface, throwing a ball back and forth. Even him, who's the best athlete, greatest athlete of all time, is working on his balance system. So for people who are thinking, you know, I have good balance, I don't really need to be working on it, there's always room for improvement, and you also want to slow down the regression of your regression of balance. So even if you're feeling really good right now, there are things that you can work on to maintain or even maximize it, what you're able to do. So thank you very much for tuning in. Again, my name is Max Cantor. I'm the Vice President of Connections Physical Therapy. I'm also a physical therapist. We have a lot of different locations throughout Massachusetts and hopefully one close by to you. We have a couple in New Hampshire. Like I said, we'll get you some contact information if you want to reach out, but I really appreciate you taking the time and watching the video. Sorry we can't do this in person, but I hope everyone stays safe and healthy during this time, and we're excited to see everyone out in the real world again. Thank you.